let's bring in Sami and Faisal Ahmad. They're co-founders of Oakland Laboratories. I find this fascinating what the two of you are doing right now, because you're a private laboratory. How did you get this started?
So we've actually been in the laboratory business for quite some time, probably 8 years now or so. And then when the pandemic hit early in March, our focus was more on other specialty testing in the lab industry. My brother and I kind of sat down and said, with everything going on right now, we're in this lab space and we have to do our part for the community. So we kind of shifted gears and got some more staff on board for COVID testing, and started off with probably 400 or 500 samples a day, and now we're running over 5,000 a day.
Wow, that's amazing. But in the beginning, your focus when you started the lab was what, on like toxicology reports?
Yeah, we were doing the confirmation drug testing. So more in like the opioid abuse world and that pandemic that's been going on as well. Our focus was working with different, addiction clinics and, facilities like that.
Oh, so it was more somewhat of a private, you were working with private industries to test those individuals, because we know there could be a huge lab or a backup at so many of these labs on the state and the federal level.
Correct, yeah.
So when you get this up and running, you were doing drug testing, you make a switch. What was that conversation and what was that process like?
Oh, it was definitely an interesting one. It was definitely a big change. We were doing some molecular testing, but not at this scale. For us, it was a pretty easy decision, though. Like I said, being in this industry, we wanted to do our part in it. But yeah, it was definitely a challenge. We remember debating, okay, if we can get 200-300 tests a day, that would be great, and this and that, and and then really come now, I can't even imagine the things that have gone on. But it was challenging because, especially in the beginning, there was huge supply chain issues, getting swabs and getting plastics and so many things. But we made it through somehow.
Faisal, if we can bring you into the conversation, when you're going through this process in the very beginning, we're thinking maybe 2-3 weeks. Did you guys know right from the beginning this was going to be a long-lasting issue that needed to be addressed?
Well, we knew it was going to be a serious issue. We started really taking this seriously and trying to get live in January timeframe, January, February. It took us about a month and a half, 2 months to get everything up and running. We had to retrofit the lab and to upgrade it to a biosafety level 2 facility. A lot of new equipment, a lot of new staff. But really, we were having conversations at that time saying, if we get to the summer, we'll get to the fall, and things will get back to normal. And then basically April hit, and that first surge hit. And that's when you really got a good sense that this was not a small thing. This was going to be here for a while, and this was a serious thing. So from that point forward, we've kind of known, we've been preparing for this next surge for quite some time. And unfortunately, we're in it now.
And with that decision, at what point in time did you pull the plug to make the investment into the new equipment? And did you even have to hire new staff as well?
Yeah, we've more than doubled our staff now at Orchard from when we were before. Actually, a little more than doubled. We made the decision right around that same January, February timeframe is when we started issuing all the POs and started all the construction and all that. And it was quite an adventure.
What was, from a monetary standpoint, how much did you have to invest in pivoting your company?
It's very significant.
You're like, it was a lot. It was a lot.
It was a lot. It was not an insignificant decision. And really, we, at the time when we started, there was no reimbursements published. There was no idea of how this was going to work financially. But we knew it was the right thing to do. We knew that even if we lost money on it or broke even, that would be fine because the community needed it. And we've been lifelong residents here in Oakland County, West Bloomfield, and we just thought we needed to have something here. So we did it, and we're still doing it.
So how does it work? Because we're in the second surge. backlog is becoming a big issue for so many of the labs. In the beginning, as you mentioned, Sami, it was about the supply chain. Now it's about actually processing the test and getting the results, as well as accuracy still remains to be an issue. Where does that stand with your company? How does it work? Do companies hire you, or is this more of a private situation where I can come to you if I need a quick result?
So we're running between a 24 to 72-hour turnaround time right now. And so we actually, in the laboratory itself, don't have any patients coming in. But we work with, urgent cares, doctor's offices, probably 70, 80 nursing homes throughout Michigan, and probably a couple hundred doctor's offices throughout Michigan. We do some testing for Oakland County as well. So we generally, if people call us, we kind of guide them to a location that's near them, and they get tested.
So we're into the second surge right now, and the number of tests that is being conducted on a daily basis in the state of Michigan has exploded. Where do you think this is going to go, and do you think it's going to continue even once the vaccine starts to be distributed?
So I think it's going to continue at this rate probably till springtime, and I think once the vaccine's out, it'll probably go down by 70%, and then really I think it'll settle down to like really 25% of the volume that everyone's doing right now. I think the testing is not going to go anywhere. I think it'll just kind of be routine, like you get a flu test, kind of thing. But I think we have till at least spring, summer with this kind of volume going on.
What happens for your company after that? Have you thought about the second phase? Like, what happens if we get post-pandemic, which those words sound glorious, but will we ever really get there? And what would that mean for your company, though?
You know what? Like I said, we've been in the industry for a long time. We're one of the leading toxicology labs in Michigan, where we service 7 states. So COVID was an addition. It's, not something that will change us in that way. Obviously, we'd probably have to change some things around, but overall, we'd be happy if this doesn't have to happen anymore.
Right. So I guess you just shift back to what you were doing, maybe, but now we're also in the middle of flu season on top of COVID. Do you guys want to talk about that? I don't know if Sami or Faisal, you want to take that question, just about what that means for your business and how you guys are addressing the additional test with COVID and the flu?
Sure. So, we recognize from our providers and from the physicians and the community that as we go into the flu season, we have this sort of twin pandemic happening, right? This twindemic, I think, is the phrase I've heard here and there, where if you're symptomatic, do you have COVID or do you have flu? Because now we're in the flu season. And it's very hard to tell them apart just from symptomatics. So Thermo Fisher is a company, kind of the gold standard of testing. They developed an assay that we validated for clinical use, which in a single test allows us to test both influenza A and B and COVID-19 in one test, so that we're cutting costs, we're not having to rerun swabs over and over again or recollect swabs from patients all the time. And if someone's symptomatic or unsure, at least we'll give the physician a great tool to, decide where or how to treat the patient, because, with the hospitals being sort of burdened right now and the stress on the healthcare system in general, we want to make sure that people who really need the appropriate care are getting it, and that we're not clogging up the system with patients that could be treated in another fashion.
That is such a good point, because, we've even talked about it here on the show. It's you get a cough or you get a sneeze and you're like, wait, is it COVID? Is it the flu? Is it allergies? I don't know what. And now as we are continuing to see a new stress put on the testing supply chain and system here in the state of Michigan, more and more people or more doctors are saying, if you don't have the symptoms, don't get tested. And we saw that in the beginning. So it's great that you guys have this as a one test thing, so that people kind of know what they are facing and what they are not. And with that, what advice would either one of you, as entrepreneurs per se, give to other businesses during this pandemic? And I know that your business is a little bit different than others, but still, are there any positives that came out of this for your business that you think you're going to continue once this crisis is over?
It's a good question.
Who's older? Which one's older?
He's the older one. I'll let him take it.
I'm the older one.
Well, if you're older, then you take the question.
There are a lot of good lessons were learned in terms of workspace and how to keep distancing and things like that. I think some of those lessons will continue because there's always, even when there's not COVID, there's always something going around. There's flu, there's viruses and all that. So some of these lessons are good. Again, like you touched on, our business was a little bit different. Whereas most people, unfortunately, were stuck at home or locked down or going remote. We were basically running at 1,000 miles an hour from the beginning of this. So our experience is a little bit different with the whole pandemic. I would say to companies, just stay the course. Earlier on, like in the very, very beginning, before there was a full lockdown and all that, we had kind of taken our staff and turned them and teamed them up so that they were unique and they had a single team together. So we never had to quarantine more than 2 or 3 people at a time if someone got infected. So strategies like that to maximize the uptime of your company and minimize the risk, I think those are useful.
Well, it's been great having the two of you with us here on the Oakland County MegaCast. We're lucky to have both of you here in the Oakland County area. Thank you for your service to the community. And I will say, Sami, since you're younger, you can go ahead and make Faisal make the Thanksgiving turkey.
Perfect, exactly.
But thank you both so much for being with us.